Health solutions company Afrocentric says it's ready to assist the government with the vaccine rollout. The company says it will utilize its network of 3,000 experienced and registered nurses who will travel anywhere in the country and have the ability to provide over 150,000 vaccinations per day in the right conditions once the vaccines become available. The group aims to assist the government with the first 2 phases of vaccinating essential workers and high-risk people. To discuss this more, I am joined by Afrocentric's Chief Executive, Ahmed Banderker. Thank you very much for your time. So how are you participating in assisting the government in vaccine procurement?
Good afternoon, Anlie. As you know, the government is doing quite a lot of work working with the manufacturers in trying to source supply of it. Where we come in is the next phase of it by ensuring that we have the necessary cold chain and also the facilities to be able to ensure our orders are placed in with government and we're able to ship that across the country and make them readily available for our members.
So what's your planning and capacity as far as rollout is concerned? We heard there are about 3,000 odd healthcare workers. What is your strategy?
So our plan is we have 3.8 million members that we need to look after, and we have a network of 3,000 experienced and registered nurses. Our plan is effectively to deploy that nurses along with the appropriate PPE to look after themselves, also providing all the necessary tools and systems for people to keep track of the appointment system, because as you know, with some of the vaccines that are being registered, there'll be 2 doses required. And so we'll be able to administer all of that and ensure that we get them registered, appointment, and given the shots as well when the time is required.
Mr. Banderker, so South Africans have legitimate and grounded concerns when it comes to corruption around the vaccine rollout. What assurances can you give them that Afrocentric's participation will be transparent and entirely free of corruption?
So, what we do, we're a publicly traded company. As you know, we have a fiduciary responsibility to all of our schemes as well, notwithstanding that includes the police medical scheme, major schemes like Bonitas, Fedhealth, government employee as well. So we need to ensure that we roll it out for all of corporate SA as fast as possible at the lowest price point. Price points, as you know, are going to be set by government. And we're there to make sure that we roll them out as quick as possible to ensure that we get to the herd immunity. We will obviously not participate, as we've seen was prevalent with the PPE. We were provided a lot of the PPE by importing it and wholesaling it across the country and ensuring that the supply chains work as efficiently as they possibly can. To give further context, we in our businesses shipped about 10 million chronic strips of medication last year. So we're quite familiar with how to handle this and make sure that it gets out to the members as fast as possible.
So you're aiming only to be part of the first 2 phases, is that correct? Or will you be extending your participation to the 3rd phase rollout to ordinary South Africans?
No, we will extend it to all the phases, Anlie, because our schemes would require that we vaccinate as many people as possible. We've segmented our membership base into exactly all of the necessary phases that's required, and therefore we'll ship them out and create centers for people to actually arrive and get vaccinations. But we will participate in all the phases as we get through them.
You obviously also participate. Apologies. Do carry on.
Now, I was going to say, by the way, we've got full confidence also that as there are more vaccinations that get registered with SAPRA and as more trials come to fruition, that we will get more supply into the country in the coming months.
We need as many people working as part of this vaccine rollout strategy as possible to hit the message home to South Africans that vaccinating against COVID-19 is possibly the only way we're ever going to return to some sense of normality and to try and overcome that vaccine hesitancy that we've seen growing among South Africans. What's your message to South Africans about the COVID-19 vaccine?
No, you're absolutely right. The faster, we're going to do a massive communication campaign as well to all of our members, as well as all the corporates that we look after as well. And if you think about it, we need to get to that herd immunity as soon as possible to be able for us to continue with life as normal. Now, the easiest way to be able to do that, notwithstanding the phases that government has, but it would be for corporate companies to actually support the rollout program of vaccinations at their place of work. Because if a corporate can ensure that all of their employees have been vaccinated, then they have minimal risk of obviously COVID continuing within their place of work as well. And so we will drive this progressively. As you've mentioned earlier on, our network of 3,000 nurses can administer up to 150,000 vaccinations a day. That's a sizable amount that we plan on pushing out as fast as possible. And I also want to say that we're going to make our services available to the national, provincial governments as well to assist where we can.
Thank you very much for speaking to us. That was Afrocentric's Chief Executive, Ahmed Banderker.